Good morning, everyone. So I'm really excited to be here to be able to talk about something that's actually been a part of my life for about 10 years. And I know for some of you that's nothing, but for me, I'm still young, so. So I'm Julie Hackett, as she said. I'm a resource mobilization specialist based in New York City with UNICEF. So I began working on polio eradication in 2010. And she mentioned the places that I've worked, and one of them was Angola, and there I found my husband, so I have a lot to thank the GPI for. I noticed that there's a lot of inspiration in the room, and thank you to the stories that we heard from the polio survivors and the Rotarians who have been working on this for so long. So I will tell you that working on polio eradication for me has been a mix of emotions. At times I felt reward, amazement, achievement, hope, and then also sometimes frustration and even some doubt. But what has always been clear for me is the vision that I have of a world where this disease doesn't exist anymore. So it's never easy to predict the barriers and the challenges that are going to arise in an ever-changing world. But there's a quote that I want to share with you all that's been very inspirational for me, and I feel like describes the fight against polio. So this comes from our brilliant mind, Albert Einstein. Imagination is more important than knowledge. Knowledge is limited, but imagination encircles the world. So as I said, this is very inspirational for me, and it reminds me of the ideals and the beliefs upon which the Global Polio Eradication Initiative began. So 30 years ago, visionary members of Rotary International imagined a world that could be free of a devastating disease that at the time was paralyzing 350,000 people in 125 countries. They didn't know if it could be done. They didn't know what challenges were going to arise, but they imagined that we could eradicate polio, and that imagination has indeed encircled the world. So many thanks to Rotary for your vision, belief, and imagination. So I'm going to give you a little roadmap of what I'm going to be talking about today. So first I'm going to give you a snapshot of UNICEF and what we do in the world as an organization. And then I'll tell you a little bit about our history and our role in the GPI. Then I'm going to take you on the journey of the vaccine and our communication efforts around the world. Then talk about the challenges that we face. As you've heard, they are formidable, but hopefully not insurmountable. And then our way forward. So about UNICEF. We work with partners around the world to promote policies and expand access to services that protect all children. We seek to improve the lives of children and their families, especially those who are most vulnerable, marginalized, and in many cases, hardest to reach. UNICEF works in 191 countries and territories to save children's lives, defend their rights, and help them to fulfill their potential from early childhood to adolescence. UNICEF firmly believes that every child not only has the right to survive, but also the right to thrive. Historically, UNICEF has helped to reduce child mortality all over the world to reach the most vulnerable children everywhere. UNICEF works to ensure that children have access to quality education and health services, that they're protected from abuse and violence, that they have access to life-saving vaccines and supplies. And we work to advance gender equality, to empower girls, women and girls. We're on the ground to respond to emergencies such as conflict, natural disaster, and disease outbreak. We have improved child survival through water, sanitation, and nutrition initiatives, and we support adolescent girls and boys to acquire critical assets and life skills as they grow into adulthood. We never give up as UNICEF. And also this year, we are celebrating the 30th anniversary of the Convention on the Rights of the Child, which guarantees the fundamental rights of every child, regardless of gender, race, religion, or other status. So UNICEF's missions and values, as you've heard, are very much aligned with those of the GPI. In 1988, UNICEF became a committed partner in the GPI, ensuring that the oral polio vaccine would reach every child. So this was never, and still is not, a job that can be done alone. Together with Rotary, CDC, WHO, and the Gates Foundation, we have made remarkable strides. It is clear that through partnership, more can be accomplished. And apart from the core partners, the accomplishments and progress to date must be credited to the thousands of frontline health workers, national governments, the generous donors, civil society organizations, NGOs, and of course, every mother, father, and community who have opened their doors and trusted us to vaccinate their children. So UNICEF's specific role, we lead in two areas: vaccine procurement and also communications and social mobilization. It is our responsibility to ensure timely delivery of vaccines for all vaccination campaigns and polio vaccination campaigns annually around the world, and also to raise awareness among communities to ensure vaccine acceptance. UNICEF also supports emergency response to polio outbreaks and mobilizes resources for programming. Through the collective efforts of the GPI and partners, we vaccinate more than 400 million children in over 70 countries every year. So in 2018, UNICEF procured 930 vaccines of oral polio vaccine at about 15 cents per dose, which means that for just $1, 6 children can be vaccinated. So here I'm going to show you a map of where our priority areas are and how many vaccines we procured. So as you can see, the majority of our vaccines are going to the endemic countries: Pakistan, Nigeria, and Afghanistan. So I next will talk to you about some of the innovations in vaccine procurement. So vaccinating close to 500 million children a year is a tremendous undertaking. So it requires constant assessment of ever-changing situations, understanding of specific cultural and geopolitical challenges, critical thought about how to approach these challenges, and innovative solutions. UNICEF's supply division, which is based in Copenhagen, has a great responsibility. They forecast immunization demands and coordinate with local country offices to supply vaccines and materials, sometimes in a matter of days. So I'm just going to share with you some of the innovations that they've come up with over the years. So this is the vaccine vial monitor, and this is one of the coolest things I've ever seen, actually. If you see the little on the vial, the symbol, if the inner square is lighter than the outer circle and the expiration date is good, you know that the vaccine is okay. If you look over and you see that the inner circle is dark, don't use the vaccine. So if you think about, frontline health workers all over the world save time. It's very efficiency. You don't need an expert. And this is how they make decisions on whether vaccines are viable. Because this little circle shows how the vaccine reacts to heat. So very important and saves time and allows more children to be vaccinated. The pre-positioning of vaccines. Someone asked a question about the difficulty in logistics. So rainy season is a big barrier to vaccination campaigns. So this is South Sudan, where we are still vaccinating children, and we procured 10.2 million doses in 2018 for them. So pre-positioning the vaccine is making sure that it arrives ahead of rainy season, because without pre-positioning, it's anyone's guess when the vaccine could arrive. It could be days late, weeks, or maybe months, because when rainy season comes, many roads become completely impassable. Emergency delivery. So as you may know, there was an outbreak in Syria. And last year alone, UNICEF made 85 shipments of vaccines to 19 countries where children are in emergency situations. So UNICEF supported vaccine delivery to Syria, which is in its 8th year of conflict now. And this is an example of reaching every child everywhere. So UNICEF has an equity approach, and reaching every child everywhere is part of that. And in our equity approach, we seek to understand and address the roots of inequity so that children have an opportunity to strive, develop, and reach their full potential without discrimination or bias. UNICEF focuses its programming on equity to ensure that those with the least amount of access are provided with the maximum support to have the same reach. So this is an example of equity here, and you see equality is different from equity. For equity, you make sure that everyone has the same starting line. And polio eradication is one of the truest examples of equity, because it's not possible, as John said, it's not possible if we don't seek to vaccinate every child. So no matter where they are, no matter how hard they are to reach, we must use an equity approach to vaccinate all children if we want to eradicate this disease. The journey of the vaccine. So this can be a very arduous one. The graphic that I have is actually an example of in Somalia. So the journey of the vaccine can start with, it starts with a needs assessment. What does a country need? And it ends with a child receiving 2 drops of the life-saving polio drops. The steps in between require precision, planning, procurement, a functioning cold chain system, and reliable transport, which may be by car, truck, boat, or sometimes even a donkey. Then it is up to the local health workers and the local health centers and frontline health workers to do whatever it is to get the vaccine to every child. So as you'll see in the next couple of pictures, polio vaccinators go through to great lengths to get to children all over, even the hardest to reach places. So vaccinators are working in war-torn countries. This is a woman vaccinating in Afghanistan. As I said, this is in Yemen, and some places are only reachable by donkeys. Some are climbing steep, snowy mountains, and some are wading through water. They really will stop at nothing to make sure that all children are reached. So now I'm going to share with you a video from Niger that will give you a sense of what it takes to get the vaccine delivered and to reach children in the hardest places. So does anyone know how to help me to get this to play?
Yes.
Thank you.
Right. So just turn it here.
Oh, great. Okay. Yeah, actually, no.
Come close to this.
Ƙauyuka masu nisa ke taya a saman moto. In muka je a saman moto, waɗansu hanyoyi ma ba su sai mun aje moto, sa'annan mu ta shiga a kafa. Kuma idan su dole kuma dai sai ka kai vaccinate. Idan yaro guda in bai sha ba, cutar ne in ta kama dukka ta iya ta yi kwantamine gari duka. Kafin a fara ba da rigakafin polio akwai lerele da suke bi gida-gida su yi mobilize su ce rana kaza ana zuwa a ba da magani na rigakafin polio. Dadin da muke shi an yi rigakafi duka yara kowane ya samu kenan ba a samun wata matsala ko guda tun da yara duka sun sha.
So this video actually goes back as an example of our equity approach. I think I might need help again. Wait a second. I did it. Okay. This goes back. Thank you. So this goes back to the equity approach. So it also applies to our other foundational role in the GPI, which is communication. So we aim to reach every family, caretaker, and community that can help raise awareness and ensure acceptance of the vaccine. So when people say communication, a lot of people think of mass media, like radio, TV, social media, press releases, posters, banners, etc. So we do definitely use those channels of communication, but for us at UNICEF and in the GPI, communication also means something different. Communication for development, or C4D, as we like to call it in UNICEF, is a method of understanding what factors influence people to make decisions about their lives. So in the case of polio, what factors drive them to accept, or in some cases not accept, the polio vaccine? So if you think about a community as an ecosystem, you have the individual at the core, but that individual is always influenced by the surroundings and the layers of influence. So for example, interpersonal might be your family. Your grandparents might be decision makers in the family. The community can include local leaders, religious leaders, neighbors, or teachers. Organizational, we might be talking about civil society organizations or faith-based. And then you have the policy enabling environment. So what policies does the government have in place to make things possible? So all of these are factors in decision making and really a key model that we use for communication to understand the health-seeking behaviors of a caretaker. So Michelle, I think that might answer to some of your questions, gender norms. This is something that has come up in a lot of our programming. So women are critical to polio eradication and communication efforts. They're critical. They have access in some places. For example, this is Afia, and Afia is one of the 70,000 community health workers around the world. She's Afghani. In a place where maybe a man cannot enter a home if the husband is not home. So women have access to these homes. There can be a personal relationship. I'm a mother, you're a mother, this is why you should vaccinate. And actually the majority of the health workers in Nigeria are women. The majority of the health workers in Pakistan are women. We have a program now, they're called community-based vaccinators, and we realize that this leads to less children being missed because these are local, well-trained vaccinators who their neighbors know. So you're not sending strangers in. So, and then in Afghanistan, women make about 40% of health workers in urban areas. And I think that's pretty astounding for a place that has very tough gender norms for women to move around. So some of the challenges that we are still experiencing, John covered a lot of them. I like the fact that he talked about being honest, but we still have to be hopeful. So vaccine hesitancy, that's a big thing right now. And Pakistan has been one of the countries where we've seen this come up. It's happening everywhere though. I mean, evidenced by the measles outbreak that's happening in the US, but it's particularly dangerous now because we have social media. So, and technology platforms, which means misinformation and rumor can be spread quickly and, you know, with really no filter. So I'm going to show you this short video clip. Other way. Okay, so I got the translation for this, and basically this is a man claiming that the polio vaccination made children sick. So this happened back in April, and it actually was circulating around Facebook. That little triangle button means play, right? Oh, is there internet on this computer?
It's loading.
Oh. Okay, no problem. So basically what happens here, I will narrate what the video does. There's a man and he's really speaking very passionately about how vaccines have made children sick. And then he sort of motions to them to fall back on the bed. So there's all these little boys around them and it's like they're fainting. So to me, the video looks very doctored. It looks, you know, very obvious that he's telling them to do this. But we try to put ourselves in the minds of parents who don't have the information that they need and how this might impact them. So this video was extremely impactful. It was happening in the middle of a campaign. Thousands of parents went to health clinics fearing that their children were going to be sick. And there was even a mob that set fire to a health facility. So this is very serious. And, he had access to be able to put this video up. So, the way that people reacted to it was with fear and resistance. The campaign had to be called off. It was really a setback. So I'm just going to show you some of the data that we have. So you'll see pretty much a steady state from January 2018 to about March 2019. And then after the video was shown, you see that refusals and missed children skyrocketed in Peshawar. So we can't take for granted how impactful this can be, and that we really have to combat that. And I think John mentioned some of the ways that we work to combat that. So the government of Pakistan is working with Facebook to make sure that misinformation doesn't go out. We're making sure that messaging for our frontline health workers is strong, and also that there are people that people trust coming to their doors, and then also reducing the number of knocks. John is right. The salesman is a perfect example. Someone keeps knocking at your door, keeps knocking at your door, keeps knocking at your door. We're asking a lot of them. So we're thinking about, and not only thinking about what they may be thinking about, but talking to them and understanding, what they have a problem with and what they would like to see change. Okay, so some of our other challenges: populations on the move, crossing borders, relocating, escaping war, or even escaping natural disaster. So we don't work to change people's patterns. We work to meet them where they are. So for example, one of the greatest experiences I had was down in Ethiopia on the border with Somalia, and I went to a watering hole. And there were hundreds of camels and goats and everyone getting their water, and people were talking there. That's a place of meeting, and that's a place of information exchange. So this is a place where we are vaccinating. We're going beyond business as usual and thinking of innovative ways to vaccinate. So this includes places like water holes, border crossings, transit points. Conflict, insecurity, and inaccessibility. So this picture really upset me when I saw it, because there's I think 90 million children living in conflict zones right now. And it's causing, pain, unimaginable trauma. And also for vaccines, it's really hampering some of our vaccination efforts. So in Afghanistan, as John mentioned, security and access is more challenging than ever. And we're now trying to come up with innovative solutions. In the past, they've said, okay, if we're not going to do house to house, we'll do site vaccinations, or maybe at mosques. So the GPI is still working out ways that we can access these children. And the issues that happen in Pakistan and Afghanistan, they really led to a doubling of cases. So it's interesting because we can actually pinpoint what's happening, but now we have to figure out how to reverse this. Despite the challenges, we have to look at the legacy that's being left. I mean, we really are so close. Cases have been reduced by 99%. That's amazing. And that 1% is the hardest. I mean, I don't know if anybody is a marathon runner here. I'm not, but I like to watch them. I've watched the New York Marathon, and you see the people at the end. They are not like, yes, I'm almost done. They're like, oh my God, when am I going to be done? They're suffering. And it's similar to that. I've heard that described like the last mile of a marathon, and I agree with that. So, but some of the legacy that's being left, contribution to other health programs, during vaccination campaigns, polio workers are trained to talk about measles. They helped with the Ebola outbreak in Nigeria. The training that has gone on for them to be able to respond to disease outbreak is going to be something that can last for a long time. And then we have 30 years of lessons learned and sharing. So there is definitely a legacy and an infrastructure being left behind. So how do we finish the job? That is the $3 billion question on everyone's mind. Well, we are forging through. I mean, the honesty is important, talking about the challenges that we face. and what our needs are, and being innovative and also nimble to adapt to the challenges that are coming up. But it is true, because if we stop now, we will see, it's estimated that we'll see a resurgence of cases at 200,000 per year. So if not eradicated, also countries would have to spend millions to control the disease. So we have several strategies put into place. The Endgame strategy, which outlines the pathway to eradication, integration, certification, and containment. There's been an investment case developed which shows a $27 billion saving to date, and also a $14 billion savings in cumulative cost savings by 2050. And then recently, the gender strategy was developed, which is to integrate key gender considerations into our interventions to achieve a polio-free world. So we've also been listening. I mean, one of the questions that came up about other services in the community, you know, there was a report that came out from the Independent Monitoring Board that communities were saying, you've been coming around for years, but I don't have running water. We don't have basic services, so you're coming around with this drop. What else? And you can't blame them. And in some cases, it was actually causing refusals. So one of the initiatives from UNICEF, the executive director of UNICEF, Henrietta Fore, she created an integrative service delivery initiative that would increase outreach and delivery of health, immunization, nutrition, water and sanitation services in some of the most deprived communities in Afghanistan and in Pakistan. So through all of this, mostly we have a responsibility to the children in Afghanistan and Pakistan and Nigeria and around the world to continue our fight and really try to rid the world of this disease. So we keep trying with everything that we have, and we have to keep imagining a world free of polio.